How often is rhinitis so bad that it's affecting quality of life or use of CPAP, work, productivity? Do those factors come into play? And are the surveys covering some of those questions?
Absolutely. So yeah, there's a lot of questions out there about like loss of concentration, difficulty sleeping. I think that's a huge thing right now, right? Somehow sleep has become like the cultural zeitgeist moment right now for patients. Like everything, even though I don't do any sleep surgeries, inevitably I end up addressing their sleep complaints. Right, because a lot of them talk about how hard it is to fall asleep, not being able to breathe through their nose, how that mucus dripping down into their throat really clogs their ability to sleep. Right, and so so I think that all that other aspect is super important. But I do think I read a couple of reports. I think they estimate somewhere around like 30% of the population in all of the US have some form of chronic rhinitis. Right, but the reason why we don't see it as much in our clinics is because so many people self-treat, right? So a lot of the medications for treatment of chronic rhinitis are all now over the counter. Things like Flonase, Nasacort, Rhinocort, all those allergy nasal sprays, right? So by the time they actually come in and see me, that usually means it's already bad enough affecting their quality of life, right? Where they're constantly thinking about it, that difficulty to breathe their nose is making it difficult for them to exercise, or that drainage really interrupts them, or like socially embarrassing for them. Right? A lot of patients, when they talk about like when they go out and eat or when they hang out with their friends, they feel embarrassed because they're constantly blowing their nose. Right. So I do think a lot of it, by the time they make it to see me, it's already heavily affecting their quality of life.
Yeah, I like to check out the cold and allergy and aisle at the pharmacy because it just keeps getting longer and longer, and I like to see like what patients are being offered.
Yeah, exactly.
Well, it just I think it's helpful to kind of see what all is out there because it is overwhelming. And I think even more and more, I find that patients benefit from, even though things are over the counter, we talk about, okay, this one is good for this symptom and this is when you would take it. And this, this is good for this. And that way it just helps them kind of navigate a pretty intimidating list of possible over-the-counter medications.
Absolutely. Yeah, you're totally right? And if it's overwhelming for us, can you imagine how much more overwhelming it is for our patients who don't know like the mechanisms behind all these different nose sprays? They're essentially just randomly choosing and trying to figure out which one's going to work for them. And it's hilarious because so many of them have overlapping medications, right? They just go under different brand names. I really feel for our patients who suffer from this disease process, because I feel like they end up in this medical hamster wheel. Right. They first go and see their primary care physician, who start them on like intranasal steroids, maybe intranasal antihistamine. They then go see their allergist, who start them on like an oral antihistamine or like a anticholinergic or something more advanced. Then they end up seeing us, right? And we're like, oh, have you tried like Flonase? Have you tried an intranasal steroid, right? And so I feel like our patients, they're constantly in this hamster wheel of this medical care. And so this post-nasal nerve ablation really gave us the opportunity to get them out of that hamster wheel, to offer a procedural intervention when the medications aren't working.